Hi, everyone. Thanks a lot for joining this next iteration of the Cambridge Cheminformatics meeting. This meeting is occurring every 3 months, both in CCDC, in person, and also online. Then the meeting will be recorded, and all the previous editions recordings are available online as well, on the link that Andreas said in the chat. Did I hear something? Okay, maybe not. Sorry? Yeah, that happens. Yeah. So we have a lineup of 3 talks today. First talk on ligand-based 3D Pharmacophore search by Modest. Second talk on creative ways to get wet lab scientists and data scientists to work closer together. And a third talk on Common V for chemistry, image to chemical structure conversion, directly in the Clipboard. Just before starting the meeting, for the people who are here in CCDC, just sharing the fire safety slide. Okay, let me just adjust this. Okay, yeah, sorry about technical difficulties here. Yeah, so fire safety slide. So I hope everyone has signed in when they enter the building. Don't forget to sign out when you're leaving the building. Fire alarm occur every Wednesday, but not at the moment. It occurs at noon. So there shouldn't be any fire alarm. So if you hear the fire alarm, please exit the building using the closest fire exits. There are 2 assembly points. So the primary assembly point is in the parking just over there. The backup is at the exit of the building here at the back. And I think that should be all for the fire safety, unless I forget something. So without further ado, I think we'll directly go for the talks and introducing the first speaker, Modest, who will talk to us about ligand-based 3D Pharmacophore search. So please, let's welcome Modest for the presentation. Thanks a lot.
Benoit. Yeah. Okay. So seems to work. Yeah, there's no better place, I think, to talk about 3-dimensional pharmacophore search than exactly here at the beginning of the CCDC. Because of course we need a lot of 3D information for what we are doing.
Sorry, Modest, can you share the other view? Yes.
Yeah.
Okay.
Okay, I think that should be good. Yeah.
Good now?
Yeah, now it's good. Thanks.
Okay. Yeah. So for 3D pharmacophore search, of course, we need a lot of 3D information. What we have done is we created a pharmacophore search to search for drug analogues, beside other molecules, in ultra-large combinatorial libraries. And I'm happy to present this here. Thank you very much for the kind invitation. We will start with a short introduction of our company. Then I will talk about combinatorial spaces because they are the basis for our search, the libraries. I will introduce then our search methods, Pharos 3D, named after this famous light tower in the Antique in Alexandria, at the harbor of Alexandria, guiding the ships. So we guide the search in large spaces as the light tower was guiding the ships on the sea. So I will then present a detail first from our search algorithm. Then I will explain the whole mechanism, give you a short overview, and then of course show some results of searching for combinatorial spaces with recently approved drugs. At the end, of course, there are some results in the summary. Well, Alipheron, I think it's not very much known until now. It's because it was founded in last year, at the end of last year. It's a Swiss stock company. The founders, we are 6 people, are former key people of Actelion's drug discovery information technology. Actelion is maybe much more known because Actelion was one of the big successes in biotechnology in Europe. Also supported by our software. At the end, the company was sold for $30 billion to Johnson & Johnson. And today I will we focus on cheminformatics software solutions, and today I will tell about a combinatorial space creation and search with game-changing algorithms. So we will start with combinatorial spaces. Combinatorial spaces are not recent. They already started in the 90s of the last millennium. It started with the combinatorial libraries. In the 2000s, then it became obvious that it is necessary to create algorithms to search these spaces. So there were these tree algorithm, feature tree algorithm for combinatorial libraries, and there already the libraries became large, searched by Matthias Raray and Martin Stahl. In the 2010s, the libraries grew from large to ultra large, and they became more professional, accessible. Ultra large combinatorial libraries became part of the design, make, test, analyze cycle and drug discovery. So they became a part of drug discovery. And also what we observed there is that there was an end of enumeration because it became just too many molecules. So not enough computational power and space for storing it. In the 2020s, so this means now, we have several professional or we have several suppliers with libraries which exceeds the 10 billion range. So we have the real space from Enamine, eExplore, eMolecules, and Cheminformatics from Ottawa, just as an example. Yeah, please, if you want to have an overview, I refer you to this nice review of Vendivar at the bottom. Well, combinatorial library spaces, they are a description, a way to describe libraries of synthetically accessible compounds. The pure difference to the real molecules, to the real building blocks or molecules which are then combined into products, is that here we have so-called clipped molecules. Yes, you see here that the reactive part of the molecules is replaced with uranium and transferred uranium atoms. And this makes it then quite easy to perform a synthetic reaction, a virtual reaction in the computer. And the whole set, the synton sets of a synton reaction, so this means the synton, the reaction rule, and the syntons, the components of the reactions, yes, so 2 or 3 components usually, they define the combinatorial library space. Combinatorial library space in drug discovery are used a lot. And in fact, they are part of the digitalization process in drug discovery to accelerate the design, make, test, analyze cycle, because they are a way to transfer knowledge from the databases with the reactions and the building blocks into the drug discovery on a big scale. They organize reactions and they organize building blocks. And this organization, as I have just shown you before, gives access to billions of new molecules. Now we are able to somehow have billions of molecules in the computer, not enumerated, but in as combinatorial library. What we need is, we need access to them. We need to be able to search them. And this is what I'm talking today. The substructure search was recently solved. Since yesterday, it is available for free in Data Warrior. So you can search, for example, the enamine real space for free with 38 billion molecules for substructures. But this is interesting, but modeling biology, as you all know, needs 3 dimensions. Yes, proteins are 3-dimensional. The ligands, of course, they have to bind in a 3-dimensional way. The pharmacophores, as we understand the interaction with the proteins, they have to be 3-dimensional. So we need algorithms to perform a search in the 3D pharmacophore space to find really fitting molecules for our proteins. Searching in 3D with molecules means you need a conformer generator. We are using the conformer generator by Thomas Sander, which was, I tell it here, it was derived with 500,000 crystal structures from the COD, sorry, for legal reasons. And the algorithms takes a molecule, cut all rotatable bonds. The remaining fragments are then self-organized in 3 dimensions. And then these self-organized 3D fragments are reassembled with torsion rules. This algorithm is quite fast. We can create more than 1,000 random drug-like molecules in less than 1 minute. So we have a possibility to create meaningful conformers, meaningful in the way that the conformer creation rules were derived from existing crystallographic conformations. And now we want to create conformers for the syntons. This means for the parts of the molecules we want to assemble to find new molecules. A synton, of course, as you have seen it before, is a molecule which was clipped, so it has uranium turns uranium. It makes no sense to calculate the conformer for that. There will only nonsense coming out. So what we are doing is, and this is now the first part of the Pharos 3D search I present today. What we do is we create a diverse sample of the syntons. We react them, and then we have the product or the products, and these products are full enumerated molecules. And then we take these molecules, and for these molecules, we calculate then the conformers with the conformer generator. Here I show that you can also do this in Data Warrior, and we are using the same algorithm. So we have here, you see it on the right side, we have then the conformer for one sample. And in fact, we calculate, of course, multiple conformers, and we do it for a lot of samples. So at the end, we have the product conformers. But because the product molecules, the product samples were created from the syntons, we are able to map now back the 3-dimensional structure of the product conformers back to the syntons, back to the part of the syntons where it belongs. So this means except, of course, the transuranium atoms. And so now we are able to create a 3-dimensional description of our syntons coming from the real product conformers. And this conformers, these synton conformers, are then mapped into a descriptor, the Flexifor descriptor. And this Flexifor descriptor is a multi-conformational descriptor, so we can map multiple conformations of the synton to this descriptor. And then we use this descriptor for the first step in our Pharos 3D search for the 3D pre-screening, which already reduces the number of syntons for usual search by more than 60%. This is more than the half, but in fact, of course, we are here now talking about combinatorial libraries. This means you all know the term combinatorial explosion. Here we have then a so-called combinatorial reduction, yes, because we are reducing the half of the syntons already. We have just like the square root or even more of less molecules than to analyze later on in the next steps. So this is our 3D pre-screening. The whole Pharos 3D in fact has multiple steps, and I just presented the first steps, the synton conformers pre-screening. Then we have a Pharmacophore subgroup matching, Flexifor descriptor screening, and a Pharmacophore shape alignment screening. This means we have a second Pharmacophore descriptor. I will explain it a little bit more on the next slide. This Pharmacophore shape alignment screening, this feather descriptor, is a single bioactive, a single conformer descriptor. This means it takes the whole molecule, the crystal structure of the whole molecule. So this means we also consider here the stereo conformations of the molecule. Yes, because we have here only a single molecule, and we are screening with a single conformation. We are screening with a single conformation, and then because we have a single conformation and we fit the single conformation to the library molecules, we have at the end an alignment of the molecule, which gives additional information. We have the alignment of the hit molecule to the query molecule. I will show you 3 results at the end of my talk. So we have 2 descriptors, the Flexifor descriptor and the feather descriptor, a multi-step filtering process with heavy pruning and parallelization. The result is the combination of these descriptors, which behave orthogonal. This means they have together synergistic effects because they they are using different algorithms. The result is an excellent enrichment by this process, which we were able to validate in projects and with the data set. The manuscript for the FESA descriptor is in preparation. The Flexible was already published in 2008. We have the, yes, and now we are equipped, armed with the algorithm for the 3D screening. And we want to have, of course, a test setup. A test setup are always good for searching analogs, and drug discovery is always taking the most recent drugs. And here, in 2023, I found 8 drugs where the 3D crystal structure was available. Capivasertib, the iptacopan, momelotinib, nirmatrelvir, pirtobrutinib, quizartinib, sotagliflozin, and vamorolone. And now we were searching analogues for these 8 molecules. We were using 3 combinatorial spaces. I just present here shortly a bit closer the enamine real space. I think you all know it. It's a gold standard for ultra-large combinatorial libraries, contains 38 billion distinct molecules. We found unique pharmacophore point pattern 30 billion, and enamine guarantees a high probability that the molecule you send them is that it can be delivered. I was told that the probability is higher than 75%. This was I told from customers, in fact. And what we have here now is the first result slide, the comparison of the three ultra-large combinatorial libraries. Libraries we compared as the ChemSpace, from ChemSpace, the freedom space, with 25 billion compounds, the enamine real space with 38 billion compounds, and then a relatively small space created from ChemDiff building blocks with 4 billion compounds. You see here on the bottom of the slide the 8 drug names. And on the y-axis, you see the top FESA score, which means this is how good the alignment of pharmacophore and shape was for the best hit for the drug. So we have here what we see here is that their iptacopan had the best fitting hit, whereas it was quite difficult to find something from nirmatrelvir, and also for vamorolone, which is a steroid, was not easy. But if we can say if a hit score is over 0.65, then we have reasonable fitting molecules. And so we see here that for 5 out of 8 targets or query molecules, we found something reasonable, and the libraries, and always the different libraries. I will now show you the examples. For this one, we found this momelotinib. We found this in ChemSpace. The bright molecule. The bright molecule is the drug molecule. What we were searching in analogues, the dark molecule is the best hit we found. And here we have the top hit FESA is 0.71. And the best hit was found in the ChemSpace in the 25 billion molecules. We were searching exhaustively. This is possible with our algorithm. And what we see is here more or less reasonable good hit. But at least it is something we can start, at least for the left side. Much better was the result than for iptacopan, where we found the best molecule in the one of the best molecules in the relatively small ChemDiff space. And I show the result here because the space is small and the result is quite amazing. The molecule fits extremely well on iptacopan. As we can see here, as I already mentioned, the dark atoms are the hidden molecule, and the bright ones is the drug. And what we see here is an extreme good fit. So this molecule would be quite interesting to be tested on the same target as as iptacopan. And what you see here also is that you can really find smaller molecules, well-fitting, adapting smaller molecules with this algorithm. Yes, because this molecule had a really high score, besides the fact that, that it is a bit smaller than the original molecule. The last example I want to show you today is capivasertib. Here we were searching the enamine real space with 38 billion compounds. And like the hit before, we found an extreme good fitting hit, the best hit found for enamine. And we have here an extreme good overlay of shape and pharmacophore points. So we can summarize. We have now a fast pharmacophore search, which takes around 5 to 10 hours on a desktop computer for one target in the enamine space with 38 billion molecules. And we searched 3 ultra-large combinatorial libraries with 8 approved drugs. What I can show you is that the scoring of the scoring is already meaningful, because what we have seen is if the scoring is good, you have also a good fit. This means a good scoring correlates really with the fit of the molecules and pharmacophore and overlay. I mean, this is the reason for the development of the phasor descriptor, that you have a meaningful descriptor with a meaningful scoring. We found good fitting analogues in the chemical spaces, in all 3 chemical spaces, which can become new starting points for medicinal chemistry. Take home to be successful, use multiple suppliers. It is always good to look not only into one supplier. You need quite a diversity of building blocks for your targets. And of course, important is also that you use your own in-house building blocks to gain intellectual property. I mean, we can help you to create combinatorial libraries with your own reactions and molecules. Yeah, and I think what I showed you is that searching combinatorial spaces with pharmacophores is really a game changer in the future. I have, of course, this I have not done alone. I have to say thank you several people, Thomas Lippert for the ChemDis space, beside others, Joel Wahl, of course, for the phasor descriptor, Thomas Sander for the conformal generator, and a lot of other source code as well. I have to thank you for the for your kind attention and the invitation. And yes, don't be shy. Please contact me if you want to test Pharos 3D. It is running and ready. So there's the email address, and I will be happy to answer any question comparing to this. Thank you.
Thanks a lot for a very interesting presentation. Do we have any question in the audience? And I think we have some questions online. Yeah. Sorry.
Hi, I thought it was a very nice talk. I think one of those compounds that didn't score very well was actually a covalent inhibitor. Would that have an impact on your?
Yeah, I mean, I cannot really, if it is covalent inhibitor, I cannot really recognize this. Yes, this is true. There is no reaction chemistry involved in the search.
Hi, thanks for this great presentation, and also big thank you on behalf of the community for Data Warrior, which you're still sort of expanding. You're further expanding with the new company. I have a sort of detailed question also about one of the examples. How do you protonate and tautomerize your compounds? Because I saw one case where you have an acid, but I saw the protonated sort of neutral form that was sort of shown in the example.
No, we are not protonating. It is the way how we then calculate the descriptor, the pharmacophore points. Yes. So if it is an acid, it will be an acid pharmacophore point. It will be an acid pharmacophore point. So it is not like docking. Yes. So the description of the pharmacophore point is then in the pharmacophore point.
Irrespective of the protonation state, etc. Okay. Thank you.
Okay, so we'll take the questions online. So what is the limitation of the number of generated molecules that Data Warrior can handle? The first question.
Of generated molecules or of combinatorial, the size of the combinatorial space. And also the largest combinatorial space I have searched so far with the Pharos 3D were 600 billion molecules. And I think because of the way how we do it, I think there's nothing I can now cite whether there's a real limit. So not with the nowadays available combinatorial molecules. And I mean, the secret of doing it is not to enumerate all the molecules. Yes, you have, it is, yeah, I mean, most of the work I presented you this multi-step approach. Yes, I mean, most of the steps are exactly there to prevent to enumerate molecules. Yes, I have to sort them out before, because enumeration is expensive, computationally expensive, and extreme expensive is conformer calculation is expensive. Yes, so we have to calculate. This is the reason why we calculate the conformations for the syntons before. So I can skip a lot of full molecule conformer calculations after. I think this is the deciding point. But so far, yes, the largest library, so far we analyzed 600 billion molecules.
Thank you. And we have a second question. The 3D analogues, do we get a distribution of the overlap score function of possible conformations or single pose?
You get the best fitting conformer, but in principle, it is possible to do a multi-conformer overlay. Yes, but as the algorithm is implemented at the moment, it's a single score from the best fitting analog. But you can also do a flexible, also you can do then at the end, if you really want to analyze your results, really, you can also do a flexible alignment, and then you have really, really close to reality score for the alignment.
Okay, and then we'll take one last question online. So, do you have any data or experience on comparing the docking scores using the built-in docking program in Data Warrior?
No, not yet, but not yet. We have not done it. But what, of course, we want to do is we want to have then docking as a next step in it for the further refining of the result, because this is a logical consequence. But so far, we were totally occupied with making this one. Yes.
Okay. And then, I mean, there's like a second part, which is how does Data Warrior docking prediction compare to other docking software such as AutoDocViner?
No, for docking software, I'm definitely the wrong. Everything about ligand-based molecule comparison, but not about docking, please.
Yeah. Maybe let's take one last question. I think we have time for this one. Could you please elaborate how long such a query takes to be computed and on what kind of machine?
Yes, of course. I mean, I have done all 8 comparisons on these 3 supplier libraries on my desktop at home, which is a recent machine with 6 AMD processor with 16 cores. And it took, for the longest comparisons, it's around 10 hours. I think we reduced it now to 5 to 6 hours for one. And we are working now on a cloud-based solution, so I think we can come down to half to 30 minutes for one comparison.
Okay, thank you very much. Yeah, maybe that's one last question in the audience. And then we'll skip to the next presentation. So if you have any more questions online, you can send an email to Modest. I think he will be happy to answer.
Yeah, for sure.
Great talk. Have you done any experimental validation?
We have already done in the last company Idorsia where we were applying this algorithm regularly. We were not doing it the most. I mean, the Pharmacophore we are using since years. When I was publishing it, it was 2008. So yes, there was a lot of validation. So it works. Yes.
Okay. Thank you very much for your talk. That was very interesting.
Thank you.
And yeah, I think we can introduce the next speaker, who is Raminderpal Singh. There you are. On creative ways to get wet lab scientists and data scientists to work closer together, which is Hitchhikers AI. So looking forward to hearing from you.
Yeah,
Thank you
thank
very
you.
much.
This mic, right?
Yeah, that's the mic.
This
Yeah.
mic, yeah. Thank you. I don't know what to say. I mean, after that sort of talk, anything I say is just going to be completely rubbish. So imagine he's looking at this bit. I'm going to talk at this bit here. Okay, so I need everybody to, drink a coffee and get a bit high. I honestly don't. So my background is actually semiconductor engineering, fun enough, PhD 30 years ago. and spent most of my business life in the States, technical life, and I spent most of my industry work, IBM research and places like that. What I'm going to talk about today is a little bit like 1,000 levels higher level than the Modis talk. And it's really important that we get to this conversation because Andreas is on the line. He's a really big supporter of this program. I don't know if Friedrich's on the line. Is Friedrich Rippmann in part of this group?
Sorry?
Friedrich Rippmann. Is he online? Doesn't matter. So I've got a lot of support coming in from the chemists in the world. But what you'll hear is more about chemistry, biology, early discovery, and things like that, bigger picture. And if that's interesting to you, great. I don't know if anybody's read Hitchhiker's Guide to the Galaxy, but yeah, thank you very much. And non-English as well, so that's really good. But there's a real problem in the industry. I mean, if I can't understand a word he says, then you can bet other people who buy his stuff don't understand a word he says. And that's a big problem. And it's all this, you can talk about cheminformatics. In fact, cheminformatics at some level, by the way, keep an eye on me for time, okay? Keep an eye on me, just start yanking me off the stage, right? Cheminformatics is probably the easiest topic in early drug discovery when it comes to AI and data, because you can turn up and you can do a simulation like this on a computer. You can talk about 8 cores, you can talk about cloud, you can talk about algorithms, you can talk about data annotations, and the person on the other side of the table isn't falling asleep. The buyer is not falling asleep. But if you look at early drug discovery as a whole, it's really a bad area for AI and data adoption. All these things we talk about are kind of anecdotal examples, and then you can go off and you can look at the news about the big companies, what they're doing, or companies like in silico medicine. I don't know if you've heard of these companies, or Exscientia, Recursion, or whoever. But if you take them out of the picture, you've got all these biotechs who are not doing AI and drug data. They're not. It's just not happening. So we're living in a kind of a false world of a lot of presentations and not much adoption. You compare that to other industries like fintech, banks and things like that. They just use it every day. Day trading's been around for 20 years. I mean, it's just everywhere, really. So this talk is less about giving you the answer because I don't have the answer. It's more about getting you guys to be involved in helping us get an answer. That's why I'm here. I'm here to sign you up. If that wasn't in the agenda, that is now. So please, if we can, could you go to this website now? You all have phones. I know that. And I know they didn't take your phones. And I know that you can access cell towers. Go to this link and you just sign up. You're not signing up for any time. You're not signing up for any work. But what you're doing is you're saying, look, I'm a chemist. I presume most of you are chemists, right? And folks on the phone as well, please. And all I'm really asking is you're just going to get on a newsletter. It's not even a newsletter. You're just going to become part of the grassroots community. There's no organization, there's no money, there's no NDAs, there's no IP. This is genuinely grassroots organization. I'll explain in a minute what we're trying to solve. But you'll get to learn about it. And if you've got an interest in AI and data and being adopted, as opposed to just being presented, this is what we're doing. So please, if you can, go to that link and sign up. I think the video is available afterwards, so am I correct? Yes, so we will hunt you down until you sign up. Okay. So just about the problem, and I mean, it's a real problem, right? We get a great presentation, and we've got all these vendors out there, and many of them are really good. A bunch of them are pretty crappy, but many of them are really good. And they can't make any money because nobody cares. That's the term you'll hear me say. It's not my term. I've heard a lot of good salespeople over time talk about this. Nobody cares. I can do this. Nobody cares. I can do that. Nobody cares. I can do it in half an hour. Nobody cares. 600 billion. Nobody cares. And the reality is because you've got scientists and they're trying to do early drug discovery. They're trying to do target ID. They're trying to do some compound work, some hits. They're trying to do some optimization, and this is in vitro work, right? So you're not animal work. I presume most of you are pretty clued up on how this works out. But if you take a biotech, they go through three or four phases really. The first phase is this in vitro, this early drug discovery. You do your target. Maybe you've already got a target. You get some, you do some compound ID. you do some optimization. Optimization actually is the hardest part of that. And then actually the company changes. At that point, you start raising different types of money. And you can change your company. You start hiring a chief medical officer instead of chief scientific officer. You start having to go work a lot more CROs because you're in animals and in vivo. So I've got to stay near this thing, don't I? And you do a lot more animal work. And then you're on different levels and different teams, and you're much more reliance on, you know, your SAB, your scientific advisory board, advisors, etc. And then you go into early clinic, and then you go into late clinic, and you probably out-license before you get too far along that, before you go to market. In the early phase, that first phase of those 3 or 4 I mentioned, you got a lot of biotechs, you got a lot of folks, and most of them just fail off the vine because they can't meet the financial curve, they can't meet the deadlines for the wet lab data, and it is wet lab data required, and they just fail. And they know they need AI, they know they need to reuse data, everyone knows all this stuff, but they have no clue how. On the other side, you've got, on the left-hand side, you've got folks who are promising everything. You know, everything. And the idea here is these guys on steroids, you know, they're coming out of school, most of them are young, they don't have the experience in most, they don't have your experience. A lot of these are kids coming out of school with some algorithm, and especially in a world of Gen AI and LLMs and yardida or whatever rubbish. And so these guys on Kool-Aid, those guys are just under the gun to get the next lab data, and these teams don't work. And you know, I mean, come on, really. I mean, really. And I dare you to know anybody who knows everything about who does everything in this world. I dare you to tell me. I mean, what I've learned. You do really? Yeah. Yeah. So do you know how to set up an LLM and know how to do how to use, for example, Scikit coming out of Python? Okay, good. So I know one person then. Thank you. Point is that it's really complicated. Sorry, one person in the room saying it's easy, by the way, but just FYI. Just myself. And you got a lot of people promising a lot of things, and it's really messed up. You know, there used to be a day when you turn around, and this is really true. I've talked to a lot of scientists, real scientists from 20, 30 years ago, used to use R, use spreadsheets, do their own data crunching, and they would kind of then do the wet lab data as well. Now we're in a world of a separation, you see, separation not in big companies only, but also in smaller companies in the way they operate with vendors and with data scientists. And now data scientists have become a Python event, or it has become a, you know, what's the latest RAG? That's a thing you do with LLMs, with Gen AI, with, you know, all this natural language. It's become a series of objects and the deployment of these objects, and they've been separated from the scientists. Now the scientist doesn't understand these tech, which you can't blame them, but therefore the adoption becomes really hard because they don't understand the tech. And the other problem is if you invest a lot of money in tech, it needs to work because you've got VCs who are saying, look, where's my payment? Where's my monetization? Where's money coming in? And the problem with that is that they're under pressure now to, my watch has just gone crazy telling me that a load of people have signed up. I want to thank you all. If you haven't signed up, please do. But I've just had like 20 beeps or something from that. The point is that if you can't get the revenue from all the tech you've invested in, then you can't claim victory. So what you do is you just go sell snake oil. And this world has now become dominated, people making promises about what their AI can do. And some of it is actually quite good. But sorry, Modus, I'm just using as a case example, but Modus will turn up in a conference and he'll have a booth. I'm not saying you will, but he'll have a booth and he'll say, I can do this. And the next 10 booths will promise things they can't do. And the buyer can't tell the difference. That's the problem. That's a real problem in any industry. So here's a comments from an actual CSO, a real person who lives in Cambridge, small biotech. So just so you understand, I'm not making this up. These are real problems. So this guy, we'll just call him William because his name's William. And so I asked him, I'm writing a masterclass. By the way, everything I'm doing is free. I don't have a company. There's no, I used to run a company here doing causal inference, which I bet you don't know what causal inference is. Okay, go on.
Cause of influence.
Inference.
Inference.
No, it's a method coming out of UCLA. It's a kind of a Bayesian network method. Okay, no one thing, right? But the so I've come from a world of trying to sell into this market. This is a gentleman who's trying to, but I'm not a seller here. The Hitchhikers AI is purely non-profit, you know, purely grassroots. So here you've got a gentleman who's saying, look, I'm a scientist. If you want to sell to me, and I need this feedback because I'm going to, I mean, presenting, you know, the Cambridge-wide Open Day on June the 12th at Hoxton House. I'll be presenting that day, kind of a 45-minute pitch on how to get started with the stuff. So look, look at his comments. I mean, in fact, I won't even read through it. Just spend a second and read through his comments. All right, you had enough time. The point is that creates a blur. If I'm a buyer, if I'm a scientist, chemist or wet lab chemist or biologist, and I'm trying to get stuff done in the lab, and I'm faced with these series of questions. This is a sophisticated person. The rest, the normal scientist will have this in the back of his or her head and won't be able to even express it properly. I just get bored with this, or I get, you know, days out, and I just get on with my work, and I just don't bother talking to the vendors. I'll turn up at conferences to learn, but I won't do anything about it. That creates no activation energy, which means nobody buys. So this is a great example of the sort of challenge, great communication of the sort of challenge we're facing. And we want both sides to win. So just to raise that out, so to express this, vendors turn up and they say these things on the top right. Tell me what you need. I have an algorithm for it. Hey, I do algorithms. You got a problem? I've got an algorithm. And these people really exist. I'm telling you, they seriously turn up and say, whatever it is, I can find an algorithm to solve that. And they really believe in it. And then they'll tell you, I can tell you the answer, but I can't relate it to your biology because I'm not a biologist. So I can give you an answer. I can tell you what do they say? I can tell you what the data says, right? And by the way, in this world, you know, I'm sure you most of you know, right? The problem is the data. The data's bad, right? The data's got imputation issues. The data's not clean. It's not reproducible. I mean, come on. This is life sciences. These guys on the left, they don't get that. So then it's the data. And by the way, I can auto clean the data for you. I can auto curate the data. I mean, the promises are very high. Public data will be sufficient. Don't worry about it. If you don't have the data, we can use public data. I mean, I used to say this. I mean, it's my company. You say that. And trust me, there's always a trust me thing. And then you have at the bottom, you have biologists, wet lab chemists or biologists who are saying, look, I don't have the data you need. You need data for what you want. Biology is far more complex. I don't believe in reductionism. And this is an example of the problem. It's a real classic. The scientists say, you guys on the left don't know what you're talking about because you've got reductionist models. What do you think an in vitro experiment is? It's one big reductionist model. I don't know if anybody gets that. Does anybody understand that? An assay is a reduction. It's a massive reduction. You have no clue what's happening. You're just hoping that some wet data will turn up, making your point. And you have no clue whether you got lucky or not. But if the wet lab shows it, you then take it over to your VC and you claim victory. That's huge reductionism. But they're claiming these guys are reductionist. And then the last point is they expect validation, which a statistician will tell you that it's not validation. It's just a demonstration point. That's not validation of anything. To put one more topic on this piece, there's a gentleman who writes a newsletter. I don't write newsletters, but the gentleman writes a newsletter, and I found this section from his last week's one quite helpful. It's really expensive to do this right. Not everybody can do it. That's the message from this slide. It's really hard to do this right. Not everybody can do it, which means, again, that the small to medium-sized players on both sides, they're being left out of the market. So if folks in this room want to start a biotech, if folks in this room want to start a tool vendor or a data vendor or a software vendor, you haven't got a chance. That's not a great statement, but you haven't got a chance because it's really expensive to invest to get it right, to make it work so that people believe in it. So the big guys just get bigger. I don't know if you guys watch the regulatory space over AI and things like that, but you see a few months ago, Facebook and all these characters were in front of the Senate hearing committee, and they were saying, yes, we need regulatory. Our friend Sam Altman, you know who is Sam Altman? You even know that name, Sam Altman? Really kind of popular guy, bit of a weird guy. OpenAI, runs OpenAI. He's turning up in front of the senators saying, we need regulations. Why does he care we need regulations? Because only big guys can deploy regulations, small guys can't. This is the same with things like GDPR, you know, small guys can't comply. They just hope they're not going to get sued by the EU. So the problem here is that only big guys can do this properly. And that bugs me. So Hitchhikers AI was created so small and medium-sized guys on both sides, biotechs, chemists, biologists, and the people making the tools have a chance of surviving in the marketplace, even when things are really, there's a lot of headwind. So what we did, and this is the creative part. Well, I don't know if it's creative. We spent some time. We've only been around for 6 months. But when I say we, it's only a community. It's a couple of hundred characters, a couple of hundred folks. If you go on the website, you'll see a steering committee of about 10 people listed. We're adding 3 more people. Andreas is on there. He's been absolutely core to helping us understand what we're trying to do, what it means, where to go with it. But it's all about people saying, look, I get it. There is a problem. We've got a couple of people from Broad, NIH, ex-Scientia. We've got different types of characters, West Coast, East Coast, and Europe as well, and UK. And people surface who really want to make a difference, either because they're trying to sell, and actually they do care because otherwise they can't make money, or actual scientists saying, look, I want to use AI and I don't get it unless we do something about it. So what we worked out is that the translation point, because this is translational activity, between the left guys and the right guys is these green blocks. And we worked out that if we can demonstrate to the guys on the right what the opportunity is, then the guys on the right will naturally activate and the market will start flowing. And this is a pipe problem. If you have a plumbing system and you have a broken pipe, then it doesn't matter because the pipe's not feeding. But if you can patch the pipe up and get liquid water flowing through the pipe, then someone will say, look, that's a useful pipe. Let's go fix the pipe. Let's get that pipe working. Market dynamics work, but you have to kind of create energy for them to work. You have to get them going, you see. So what we're homing in on, and we're learning as we go through this, is this green thing, is that if we can work on specific projects, and that's a community of folks, like for example, at the present moment, we're working on Parkinson's disease. There's a gentleman in London called Richard Weiss, who's pretty big on GLP-1 agonists for Parkinson's. And we're working on helping him understand how to bring the dossiers and to allow clinical trials to be much better designed. And if you go on our website and you go to the review page, there's a video of that discussion from last Friday where the team's talking about the progress in that project, amongst other things we're doing. Talking about benchmarking, for example. So for example, there's lots of vendors who are turning up who are saying, look, we need to be able to show that our stuff's really good. Right, cool. Well, let's benchmark that, but let's benchmark it in a kind of a nice horizontal way where a variety of key questions which scientists are actually interested in want to see why that's valuable, not just some sort of open source type benchmarking for the sake of computational benchmarking. So we're looking at things like curated data in these demonstration projects, computational tools, because you have to have tooling. Some of those tooling could be open source. We're talking to a group called Acilia.io. Did anybody heard of them? Acilia, Spanish outfit. They do a whole bunch of stuff for communicable diseases, mainly for African countries. They're totally open source, and what they do is they'll take some open source software and they'll curate it to the point of being usable, which is kind of important. And so the computational tools could be vendor tools, because we want vendors to win, or it could be some sort of very well-matured open source software. We're putting some education on top of that, and then we're consulting. Now, consulting is a bad word here, and I realized that as soon as I started using consulting and using that word with people, England is full of consultants. Nobody likes the word consulting. So what I really mean here is actually understanding the problem through conversation. So as a non-profit, for example, in Parkinson's disease, we're spending time with Richard to understand what is the problem he's trying to solve when he's connecting all these clinical trials, these early stage clinical trials together, so that one can learn from trial to trial to trial. But that's a consultative process. So we are keeping things simple because otherwise people don't understand the language. Remember, it's a language problem. We're focused on SMEs, means small to medium-sized enterprises, and consulting-led. I'd be really interested if anybody's got any questions on that. Yes, please. I'll repeat the question. I
just wondered of those 4 things that you had a sense which was sort of biggest bottleneck when it comes to affecting that smoothly.
Yes. So the question was, with respect to the stack of 4, what's the biggest bottleneck to affecting the smooth flow? Thank you. So the consulting thing I didn't think about. I've been programmed with that one. In fact, it was Jackie Hunter who told me that. Do you know Jackie Hunter? Anybody know Jackie Hunter? She was a CEO of, she was a, I've forgotten the science park around here, but then she was CEO of Benevolent, and then she does a whole bunch of stuff. She's been around in this community for quite a long time. And she said that what you are is you're a travel agent. Anybody young and old enough to remember what a travel agent really is? Old enough, you have to be old enough. Young people don't get it anymore. They just log on and get the answer. Or they go to ChatGPT and, how do I book a journey? I don't know, whatever. But normal older people, we used to go to travel agents when we wanted to do some big trip. Book this, book that. I have no clue what to do. Just even if I didn't know where I want to go, I just want to go to a beach. So you walk into Thomas Cook and you say, "Can you tell me I want to go to a beach?" And after about an hour, there's this big expensive package I have to pay for. That's how we did things. That's actually what we're doing here. We're not providing any service, but we're helping build that based upon what the scientist is trying to solve. Think about the question and be the travel agent to pull the pieces together. Some of those pieces will be new education, maybe. Some of those pieces will be current vendor tools, because we've got vendors in the community who are hunting for ways to find channels to express, what they've got in these demonstration projects. By the way, this is not all free. This is non-profit. So as these things build, if the problem is serious enough, we're seeking grant funding or we're seeking non-profit funding at a project level to fund it, right? So we are trying to do things in a professional way. So to answer your question, I didn't think that the consulting thing would be the thing. And now I'm realizing that if the person on the other side of the table hears you, understands you, then the rest of the stack, the education, computational tools, curated data, actually they'll just hand it over and say, just go do. That's the hardest part. And that's the hardest part of any selling in this industry. The hardest part is getting the opportunity to have a real conversation with the person who's got the real scientific problem. Sorry, any more questions? Any questions online?
Maybe you can check.
Do you want to do it? Otherwise, I'm going to blow it. Yeah, please.
So is your objective to associate these people in careers, money and things like this, or is it to make better drugs?
Yeah, so the question was, is the objective to facilitate these folks in this system or to make better drugs? And I'm interested that those are different things to you.
Well, you've not proved that one leads to the other.
I don't necessarily need to prove. All I need to say is that biotechs are going to fail without AI and data. And therefore, you want to help them out? Help them get AI and data.
Successful biotechs.
I know, I do understand that, but there aren't as many as we compared to how many are failing. We're in a very tough environment now, and the raising VCs money is not as easy as it was, say, 2 or 3 years ago. So AI and data is a natural step to reducing the cost, to raising the cost efficiency. If you don't take advantage of it, other people will.
I suspect
I suspect that the greatest improvement will come from improved target identification and validation rather than the downstream activities.
It could be, but these are all upstream anyway. Target ID is part of it. But other people disagree with you. So my point is you could be totally right, and other people could be right. For example, I went to BioEurope last year, and I don't do this stuff, but what I hear BioEurope from the panel sessions is we need AI in clinical trials, not in early drug discovery. So my point is it's got to go everywhere. This group's focused on the stuff you're talking about.
The biggest failure in late stage drug development is lack of efficacy because of incorrect target validation.
I'm not disagreeing with you, but I've heard 100 presentations. They all don't say that. So what I'm saying to you is that we know what we're focused on, but it happens to align with what you said. Right? This is an industry which is all fighting on itself. The only way to survive it, to help it, is to give it something new. And to help those folks who have an AI, an ML thingy, folks who have data, help them get that out there, who have open source, get that out there, and have people who've got questions want to talk to those people. You fix that pipe and you make market dynamics turn over. And the market dynamics is a big thing. Oh, sorry, what other questions?
There were no questions.
Oh, okay.
There were
No,
more
thank you.
comments, yeah.
So last slide, I think it's my last slide, yeah. Last slide is, this is what we call a platform ecosystem. If you go to the website homepage and you look below, there's a short intro video. There's actually a link to what platform business is. Uber, Airbnb, right? Facebook, these are platforms. This is a platform business. What you're trying to do is you're trying to grease the wheels, and I think your question was correct about what you're trying to fix. Grease the wheels on that pipe working, right? Based on the hypothesis, if that pipe doesn't work, a whole bunch of people will go out of business, and they will. So you have folks on the left, you're trying to get them to focus on the right, and you've got other folks which are going to participate. But there's a little text in the red on the right side of the box, high impact pain points. We're not trying to solve everything. We might be around for 5 or 7 years. And then once market dynamics kick in around AI, and once it's proliferant in the industry, we're done. We don't need to exist. So we're not trying to create persistence and busy work. We're trying to create a kind of kickstart for the industry to get with the game, both sides of the demand side and supply side. Cool. Thanks, guys. That's mine. I'm done. Thank you.
We have some time for a few questions. Is there any question in the audience?
So I saw it on your side that it looks like data curation should be done by data scientists and AI people, not by the scientists who are generating the data or together with them. I wonder what's your experience with
Yeah,
that?
so I know a lot about data curation. That's a really observant point. And I'm not sure if that was a loaded question, because it definitely is loaded. If you ask the data scientists to do curation, they don't understand the biology or the chemistry. So what are they doing? Right? Yeah, exactly. And then they'll promise this auto curation. Sorry, I just get a bit wild with these promises. But then if you ask the scientists who say, what do you want? I'm not a data person. What do you want from me? Right? And so who's got the algorithm? Who's got the knowledge of biology? And this is you can see why the problem exists in the industry. You can see why it's very frustrating, if somebody's been around for a little while. But if we solve it, there's nothing. If you go across and you look at all the guys who are funding, there's wonderful things going on, like Emball, Sanger, then Broad, and then the NIH massive projects in the US. They don't fund the small guys. Watch it. Of course, you've got the grants for small, but the big projects, the infrastructure projects, the big money goes to the guys who are already the winners. But what happens if you've got innovation in technology or innovation in drug discovery or modalities? That innovation is very hard to pop up because it's a very crowded ecosystem. So Hitchhikers AI is all about grassroots, like the David versus Goliath. We're all about the grassroots, folks, where the innovation is, we need to see more innovation succeed. Did that answer your? So I didn't answer your question. I'm agreeing that's the problem. I'm agreeing you've identified the problem. I don't want to answer it. Okay.
Thank you. I think this is something that the academic sector's wrestled with a bit as well, because there's more and more pressure for academics to be publishing their data, which they started doing. Then it's we need to publish it in meaningful and useful ways. How do we do this? Well, you need expert data curation. So one model that's taken off in some institutions, particularly in the Netherlands, is to have embedded data stewards in departments who are domain experts and data scientists. And so I wonder if there's a scope there for cultivating new careers where you don't just have data scientists and experts, you have a sort of new breed of profession that combine those two things.
Yeah, you point to a really good point. And on the way here, I live in Leicester. I drove down, for this cover. We all listen to radio. Wait, you don't. Us young ones, we all listen to Radio 4. And the guy was talking about Finland and electric vehicles. And I just want to use the example. Electric vehicles is a bit of a sad story in the UK. Private purchase of EVs went down 18%. Forget the enterprise purchase. The private purchase went down 18% because there's no infrastructure, yada reasons. In Finland, they planned all that. Just for your point, they planned it all. So if you've got an electric vehicle, you can do some free public transport, free charging. They thought through the issues like they do in Netherlands, right? And other countries as well. Yeah. The problem is that where's the money? The money's in the US. There's a little bit of money in the UK, by the way, but the money's in the US. None of that happens in capitalist economies. So you're totally right. Where they can, they'll put some grant money and they'll do it right. But that's not going to create what we call network effects, the dynamics, spin, snowball, which creates huge value in the economy. And that's what we need to focus on. So we should learn from the academics, but we've got to work out how to make it work in a capitalist market where these people are not getting VC money for that privilege. Does that make sense? Do you get me?
Probably.
Yeah.
There's lots to think about.
There's a lot to think about, but then you sign up and you'll be part of it.
Okay, maybe we'll just take the questions online and then.
Okay, sure. Sorry for being lots of buzzes.
It's okay. I think we have time. I mean, we're going to the pub afterwards.
Yeah, I won't. I'm sorry, I won't be there. Go back to
Yeah.
that.
So we have this question here. So I will try to just summarize.
Yes,
So
please.
we have all like these AI methods, for example, to do music very easily, and even like public resources and public software can help us with drug discovery. So basically, are we at a time where drug discovery is possible for non-scientists if we use the right software and the right AI, for example?
Okay, so that's a bit of a broad question, and if you read the papers, you'll hear all about the whole Gen AI. That people like to talk like that, and I'm not sure is it NVIDIA or somebody recently I was reading about. We're at that point. I think it's hogwash. I think it's all hogwash. I think you need more scientists. I'm going to come to your point. You need more scientists on the ground doing great science. AI, ML data is a support mechanism. There's so much creativity on the science side, which is being left on the ground because they're not being supported with AI, with combinatorial compound stuff. I don't understand what you do. But whatever it does, it sounds really complicated. There's so much good stuff being done, but what does it do? It supports better science, right? So I think it's all hogwash. Anybody who tells you that AI is going to solve it, just ignore them. There's so much money involved there. There's so much money. That's they have to say those stories, right?
I think another thing, taking on that music.
Yeah.
In drug discovery, you're going to have to be, better than the Beatles. Your next drug.
Yeah, his comment was that for the music idea, that in drug discovery, you have to be better than the Beatles for the next drug. Yeah, well said. It's very competitive, this market, and it's not an emotional market. I mean, it's a crazy lemmings market. I mean, it was chasing everybody over the cliff, don't get me wrong, but it's not an emotional market. It's a market which is based upon, pure, what we call TCV, total contract value, or TMV, total market value. How many patients, how much are you going to charge, how much money is going to be made out of this? And it's ruthless, this market. Who in this room is an academic? Okay, good. Good. Because when I talk to academics, they don't get this. They think, oh, this is cool, man. Well, this is a really tough industry to make a dent. So,
yeah, maybe just the two last questions.
Okay.
How will you sustain all these intensive service activities without commercial income streams? And how many companies are already taking care of the base platform, building together data scientists an experimentalist and long-term approach in the UK?
Okay, so the first one is, so first of all, again, we only got 5-7 year plan just to kickstart, and international, a lot of US participation in it. I spent my time in the US. If you don't have US people in the room, you don't have a program, right? So just that. And so we are going to have funding on these demonstrated projects. Otherwise, the projects don't go forward. So basically, you do a lot of pre-funding kind of understanding, building. You get people in the room, vendors in the room. You do this consulting-led stuff. Then you get some funding, and you fund that project. People excited, they do some work, they then disband. You do that 10, 20 times, whatever, and then the industry gets it, the industry takes over itself as it owns market dynamics. I expect that's a 5 to 7 year process. I don't know. It's not about the money, it's about watching people adopt and wanting to adopt techniques and believing in them. And data. You can't separate data from algorithms.
Mm-hmm.
And the second question is, how many companies are already taking care of the base platform building together? What do you think the question? Sorry, Caesar. What is the question? What do you think it means?
I mean, how many actors are already taking care of? I mean, you presented your project, and it's obviously linking data scientists and experimentalists. So, is it happening right now, and how many people are involved in?
Okay. In Hitchhikers.
Yeah.
Hitchhikers is a community. It's a bunch of characters, bunch of vendors, bunch of academics, bunch of scientists, etc. So there's no hitchhikers in the middle and all that stuff. Everybody's chimed in. So we've got about, there's a couple of hundred people who are in the outer circle. You have concentric circles in communities. You go inner towards the core team. You have in the core team, you have a steering committee of about 12, 13, 14 now. And you have an active group of about 20. You have another concentric circle of vendors who are watching and trying to understand how their tools can be participatory, because that's what we want. And then you have a broader circle of people watching of about a couple of hundred. Does that?
Yeah, I think that answers the question.
Cool.
Thanks a lot for the interesting talk. That's nice news. Maybe just the breaking news, because it's on the screen. AlphaFold 3 just came out, so I guess I will know what I will check tonight. And I think we'll go for the third presentation, which I believe is online with Oliver.
Yes.
Yeah, all right.
Can you guys hear me well?
Yeah, all good.
Perfect.
Feel free to share your screen.
Yes. So let's start from the beginning.
Yeah, sounds good. Looks good.
So the title of today's talk from me is like image to smiles conversion directly done in the clipboard. And here on the right, you already see a sneak peek of the tool itself. So I'm Oliver Schilter. I did a master's in chemical engineering at ETH Zurich, then did a master thesis at MIT in the Jensen Group, got there the introduction to machine learning and cheminformatics, I would say. Then did some internship at Roche and then IBM Research, where I got offered a joint PhD between IBM Research and EPFL in the LIAC group led by Professor Philipp Schwaller. And here on the left, you see me on top of a Swiss mountain starting a reaction with my laptop in our robotic lab in Richelieu, Zurich. And in this lab, I am one of the cheminformaticians that actually spent time in the lab. So one of these days I was there, and our organic chemist, so he has no cheminformatic backgrounds, was basically redrawing molecules in ChemDraw from a PDF to get their smiles, because often the online tools for, let's say, retrosynthesis, you have to draw the molecule or enter the smiles. And I told him naively, just use MoleScribe by git cloning, then setting up a conda environment, pip install the package, then use the command line interface with the paths of the screenshot, and you will get your smiles. And some of you may already know the problem with this because of the previous talk and exclusively focus on it, that we speak basically a different language between the wet lab chemists and the cheminformatic community. And so there is a need to bridge this gap. So to make tools accessible, and in this way, having a tool that you can take a screenshot of a molecule, which is then immediately converted to a smiles and copied back to the clipboard. So with this, I'm shortly going over the motivation I already talked. Then I want to say how it's built, the features of the tool itself. I will briefly have 3 slides about other papers I did during my PhD, and then we can end with some questions. So how it's built. So I wanted to have it super easy. So what I mean with easy is no coding experience needed. So not even a pip clone, a pip install, or like git clone and so on. So there should not be an installation process, just a simple app to run. And the conversion should have been done directly in the clipboard. So not saving a file and then inserting it in a program and so on. Then I wanted it to be as offline as possible. There's many reasons. I think the first of all is like privacy matters to a certain degree. Let's say if you work in a pharma company, it's probably not so cool if you send your drug molecule to some online service that you don't know if the smiles is stored or not. Then the second one is like minimal external APIs are easy then to maintain your project, because if you depend on external APIs and they differ their specs, suddenly your long working code is no longer working. So as well as I don't want to host any of these tools, since then I have to pay the cost of running the servers. So then I wanted to have a graphical user interface, a GUI. So not just a command line interface, it should be simple and lightweight, and the app should run in the background. And with this in mind, I started with like a game plan. And the first step was exactly the GUI again. So it should be simple, and then it should live in the status bar. So the status bar is basically the top where you have in macOS, where you have all the apps showing. Then one other step was basically it should have a history feature. So I see all the molecules I already converted. And this was basically the requirements for the GUI. Then I checked out what structure to image to structure model already exists, and I evaluated mainly the Decimer and the MolScribe from the Colley group at MIT. So, and then I thought, okay, at this point, I never copy-pasted anything from the clipboard back to the clipboard. So I was like looking into this, and it's surprisingly easy. It's just 2 lines of code, lucky me. So I just have to install this package, and you can basically copy-paste from your clipboard from Python into your clipboard. So with this, I set out to look at GUI, and I settled for RUMs, which stand for ridiculously uncomplicated Mac OS Python status bar apps, and they fully deliver on their promise of being ridiculously simple. With this simple, let's say 5 to 10 lines of code, you already get an app similar to what is shown here on the left. So then these apps you can bundle, so you can easily use Py2app and so on to package these Python files into a Mac executable. So it's similar to an exe file, I would say, on Windows, the ones that not are familiar. And in this app file, there is all the packages and Python versions you need for running the app. So there is not, even when, let's say, a dependency breaks, as long as you packaged while it was working, it still works later on. On the lower left side, you can check out the GitHub for RUMs. And just to show that this code actually works, I did here a screen recording with my phone, since notifications you cannot screen record on macOS. So if I press here on this button, basically it says hi and greets you. And thanks for inviting me for the talk. So it's truly simple, and you can put in whatever function you want to run like this. Then next, I focused on evaluating Decimer and MolScribe. I ended up using MolScribe because it was running with PyTorch instead of TensorFlow, which worked way better for bundling it up in a Mac app. And also MolScribe is super easy to use. You can basically download the model and have a simple checkpoint, which you then can put in the file you saved from the clipboard, and it automatically returns the smiles as well as a confidence. And the confidence score is used to evaluate if it was just a random screenshot, let's say if something else in a molecule, or if it was a molecule, because if the confidence is higher than a certain threshold value, it's actually then saved back. If it's lower than threshold value, the smiles is not saved. So with this, I'm already showing a bit of the GUI and the functionality. So overall, you see here on the left is what is the overall structure of the GUI. And here on the right, you see how it works in theory. So you have saved, you do Control-C or Command-C of some content. And then first of all, it's identified and then translated into smiles, and then translated from smiles to whatever format you want. later a bit more to that. Let's focus first on the clipboard content identifier. So how this is done is in simple 4 steps. First of all, we naively try to see if the instance that is saved in the clipboard is an image. If it's an image, it's treated as an image. Then the second step is just try exact loops from converting to smiles, molefile, inches, and selfies. As well, later on, we try a regex pattern to see if it's a cast number. And if everything fails, we just naively assume it's an IUPAC name, because there's no easy way without calling external APIs to validate IUPAC names, at least to the best of my knowledge. So if you have a better idea, please let me know. Then after we identify the content, it's then using the library of choice to translate it into smiles. And for this, we use, again, for the images, MoScribe, for the other like inches, smiles, and mole files, we use RDKit. For selfies, we use the selfie packages. And for casts, numbers, and IUPAC names, we use first Opsin. This is the external API, or PubChem. If Opsin fails, we use PubChem, and the order is done because Opsin is in generally way faster in calling. So it's, for a user perspective, it's the fastest conversion. And then you can say which function you want to output. Either it's a smiles, then it's just copied back into it. But if you, let's say, if you want to convert from an image to a selfies, it's basically then using the selfies package from smiles to go to selfies and so on. Yeah. And the history feature also there, I was first thinking about like some SQL database, but then I remember the tool should be used by an organic chemist, and they probably have not so much experience in querying SQL databases compared to just a simple CSV file that can be opened with Excel, and it looks just like that. It's just a bare bones information. You just see the smiles as a column and then some tags of the date, so you can see when you did the conversion as well as one of the image files. So with this, it just saves the 100 last molecule images, so the app doesn't bloat in size while using it over time. And yeah, so there's something. And with this, we basically covered already the first part of the app. So where you can do convert clipboard to whatever, because it's identified, then translated to this. Then I additionally included some smiles operation, which are basically canonicalization, augmentation, and removing of atom mapping. I think informaticians are usually familiar with all of them, why we do them. Augmentation is super handy to see the model, let's say a model's robustness. If you use an online service that predicts, for example, a molecular property, you can easily try out if maybe as augmented smiles changes the predicted property and so on. Then the next functionality is actually finding price from history, which is done by querying vendors API. Currently supported are Inamine and Chemie Brunswick. Chemie Brunswick is a Swiss chemicals vendor, so we focus on this because we order there a lot. And this is, it queries it with a cast number, then it's converted into grams per dollar per grams, and then the link to the cheapest option is returned into the clipboard. And by the way, you always get notifications on the upper right side that show you what is done. So also when the conversion is done, you get a small pop-up notification that shows the conversion was successful or it failed, maybe if the image was not high quality and so on. And yeah, with this, if you press then on this open link button, it actually opens the vendor link. So just to see. And then if you want to do continuous detection, so let's say I do this mode often, I just leave it running and it analyzes it automatically. So if I press on it, it changes to this button to end molecule watching, and it basically immediately converts everything that is in your clipboard to smiles and saves it into the history files. This is super handy if you, for example, have a paper open and you want to see a molecular structure, let's say some properties, you can easily look it up on PubChem and so on. Then as well, we did some descriptors of the molecules from the history. This was also based on a request of our organic chemist, because he often actually did this step also to see the atom weight, so the molecular weight, to see if the molecule was in the MS spectrum, for example, and then you do this popular plus steps to see let's say, the hydrogenated version of the molecule and so on. Yeah, they're done with RDKit, just simple rules. And again, there's a mode where you can build up a queue. This queue is basically that the conversion, because the image to smiles conversion takes a while, so a couple seconds, you can basically put full images in a folder, and then the folder is converted automatically to the smiles and as well saved into the history. And the handy mode for this is then you can open the history file and just copy paste the smiles out that you just translated. Yeah, with this, I'm already kind of finished with the conversion part. Here, a small demo video, how I use it. For example, I take a screenshot of this molecule from the Wikipedia. It then translated it into the smiles. I have to be honest, I cut out, like, it takes maybe 5 seconds, the actual conversion process from the image to smiles, because you run the model locally and not using any GPU resources, so it's just the CPU inference. Then, for example, I can see here the history. You see all the molecules I did before. Now I select, for example, the selfies, which is basically immediate translation since it's just converting selfies to smiles. And then the cast number takes also a bit more time because you're actually querying an external API. And with this, I'm already done for the demo. So a fun fact, why the logo was chosen to look like it is, because that's the logo of the software, and the guy that inspired me, Carlo, our organic chemist, actually looks like him. So in honor of Carlo, I made the logo look like him. And with this, I'm quickly the benefits and drawback of the approach. The main benefits is that no installation, it's always present in the status bar. You don't have any dependencies that you have to manage later on. So if it works once, it should work all the time. And you have no coding experience. And I would say the formats we support currently are supported by most other tools. The main drawbacks is that it's currently Mac OS only. It's relatively slow in startup. This is due to how it was packaged. Since the models are actually in the app file, it's relatively large. I would say nowadays it's not the end of the world anymore, 4 GB, but comparatively, it's not small. And I would have to say, if you compile it yourself, it's a bit tricky to get it right if you have an M1 MacBook or an x86 MacBook. So, and one of the main drawbacks is, as currently how it is, you cannot deploy any updates iteratively. So each time an update comes out, people have to re-download that. Then some other work I did, I go here in a rapid fire mode. It's basically I predicted the solvent of reaction using burp models and experimentally validated them. The preprint is out for this as well and is currently under submission. Then last NeurIPS, I did look at the attention head of transformer model to see if they connect the spectra peak with the molecular structure, and this actually works in 1H NMR. So you can see which part of the molecule is responsible for which part of the spectrum. Here also the QR code for the paper on the right. Then most recently came out 2 weeks ago. It was like the Bayesian optimization campaign that forced me into the lab, where we combined Atinari's optimizer with the IBM's RoboRxN platform and optimized the reactions. And most recently, I also did the experimental validation campaign for ChemPro, which was today published. Actually, it's fresh out of the press, so came out today. So check it out if you didn't do it yet. And with this, I'm thanking my supervisor, Philipp Schwaller, and my coworkers, Carlo Baldessari and Teodoro Laino at IBM Research, my funding and CCR catalysis. And you can check out the paper about the Clipboard to Smiles converter here, and the code on GitHub. It's Clipboard to Smiles converter. It's free and open source, so all the libraries are open source, and it's done. And with this, I'm open to question. And I think I already know what the first question is, why it's only for Mac. And to this invite triggered me to finally convert it to Windows. So with the end of the week, I'm still testing it on a virtual machine running Windows. By the end of the week, it should be coming out for Windows as well.
Thank you very much. Thanks, Oliver. Maybe you can start answering the few questions that are online, and then we skip the questions in the audience.
Can it handle the whole PDF? So currently it's not, the intent is not the same. I think it's not made for doing this, but technically I have friends that use it like this, but then you just do this where you build up the image queue. So you spend maybe 15 seconds, or let's say for a larger paper, a minute screenshotting each of the molecules, and then you just press start the queue, and it actually then in the next couple of minutes translates all these queued up images to the smiles. I didn't collaborate it against Decimer because I never got the Decimer to work properly in the bundled up app version, so I don't know which one works better. And the problem for downloading it on Mac, there is one weird thing about Mac OS, that if you download an app into the downloads, it has not the same permission as when you move it to the application folder. So if you move it afterwards, usually this issue is resolved. I had another person try it out and had the same issue. And then you have to go to privacy and allow the app to use to sign it, because it was downloaded over the internet. It's like this security feature.
Yeah, maybe we can go.
Hi, Oliver. Thank you for the talk, and on behalf of all the organic chemists around the world, thank you for developing the tool. I'm just wondering, a real life scenario in my company full of organic chemists in the lab, if they were drawing old fashioned on a whiteboard structures, would you be, rather than, structures you've got, from Wikipedia already on a digital format, is the tool able to process those hand-drawn, chemical structures in the same way? And if so, have you tested that? And how uniform does the drawing need to be for it to work?
So on this regard, I paraphrase it because it's Molescribe, again, to just mention it again. The tool that actually does the structure to image the image to structure conversion is not written by me, it's Molescribe. And if I remember correctly, in the paper, they try out handwritten images as well, but it works decently if you have a nice handwriting, I would say, and if the molecule is not too complex, but it's not the be-all and all of handwritten digit recognition. But also, I want just to mention, as it's an open source project and you have a different model later on, you can easily plug it in. So it was developed to minimally rely on external services. So if you have another model that you want to load, it's not, you just need to install, just change 2 lines of code and you can use whatever model you want.
Any other question in the audience? Yeah. No.
You kind of touched on it there, but these programs don't always work perfectly. And it would be nice to have a way of curating those errors. So if you could see the original image, then the image after conversion, convert the smiles to an image and align it to the original. That would be that would be a useful feature to be able to see, does it corresponds before and after.
I see what you mean. That's actually a super cool idea. I will have a look into it because I see the point that you then see it overlaying. I think maybe with scaling, it's a bit of a problem, and aligning the functional groups, if the molecule get large, that you orientate them more aligned, it's probably harder, but yeah, a super cool idea. Thanks for the input.
Okay. Well, I think if there's no further question, let's thank Oliver again for the talk.
Thanks for having me.
And I think that concludes this iteration of the Cambridge Cheminformatics meeting. Stay tuned for the next meetings and for the recording that will be uploaded by Andreas online. So I think for now, people at CCDC will move to the Penton Arms for pub time. Don't forget to sign out on your way out of the building. And for the people online, you will be separated in breakout rooms to meet some new Cheminformatics friends. So I think yeah, that's pretty much it. So thanks a lot for everyone in person and online, and see you soon for the next Cheminformatics meeting. Thank you.